After examination diagnosis, we would like to select the abutment teeth which will be supporting us for the fixed prosthesis. So what exactly is an abutment? An abutment is basically an anchorage. It is a tooth, a portion of a tooth, or that portion of a dental implant that serves to support and or retain a prosthesis. Now, what is the importance? Why do we need to select an abutment? Every restoration, as you know, it will be withstanding occlusal forces. And these are the abutment teeth which will be withstanding the forces which are normally directed to the missing teeth in addition to those being applied to the abutments. Therefore, the selection of abutment teeth is important. So this will be discussed under the following headings. So the supporting tissues surrounding the abutment teeth, they need to be healthy. They should be free of any inflammation and they should not exhibit mobility because they will be bearing an extra load. So primarily there are three factors which influence abutment selection, which are crown root ratio, root configuration, as well as the periodontal ligament area. Now, crown root ratio is the portion of the tooth which is not within the alveolar bone compared to the portion of the tooth which is within the alveolar bone. Now, the optimum ratio is 2:3. This may not be achievable in all situations. Therefore, a minimum crown to root ratio of 1:1 is also acceptable. The next factor to be considered is the root configuration. As you can see, students, these are the maxillary premolars which have a more broader buccolingual dimension, so they will be able to provide a better support compared to the maxillary central incisor where the root configuration is more circular in dimension. Also, the divergent roots are always preferred over the convergent roots. The next factor is the periodontal ligament area, also known as the root surface area. So as we know, the larger the tooth, the more the surface area and the better retention it will be able to provide. So we have a concept which is known as the ANTE'S law, which states that the combined pericemental area of all the abutment teeth which are supporting a fixed partial denture should be equal to or greater in pericemental area compared with the tooth or teeth to be replaced. So in this particular situation, the pericemental area of the mandibular second premolar combined with that of the second molar should be equal to or greater than the tooth being replaced, which is the mandibular first molar. Coming on to some special cases, which includes something known as a Pier Abutment, also known as an intermediate abutment. Now, if you see this situation, we have an abutment tooth which is surrounded on both the sides by edentulous spaces. So this tooth will then be known as a Pier Abutment, and this is a commonly found situation where a maxillary first premolar and maxillary first molar are missing, making the maxillary second premolar as a Pier Abutment. Now, how do we handle such situations? In such situations, it is better not to go in for the rigid 5-unit partial denture. Instead, we prefer to use non-rigid connectors in such situations. So when I talk about non-rigid connectors, here what I tend to speak is the keyway and the key. Now, normally we give the keyway on the distal part of the middle abutment, that is the retainer, and you will have the key which will be present on the disc on the mesial side of the pontic. So as you know, there is a physiologic tooth movement. So when that happens under the occlusal loads, the key gets more easily seated into the keyway. So this has to be thought of whenever we have a pier abutment. Another situation which is commonly encountered is the mesiolingual tilted molar. Again, this will be posing a sort of challenge. So here we will see that whenever you have a tilted molar, that means there will be a discrepancy between the long axis of the molar and that of the premolar. So in such situations, the fixed partial denture will not seat as the distal tooth will intrude on the path of insertion. So how do we handle this situation? These situations can be handled by using orthodontic appliances for uprighting the tilted molar. The other treatment options could be using a proximal half crown as a retainer. So as you can see in this situation, in a proximal half crown, that means only the distal part of the tooth is untouched. The other portions have been prepared. So this could also be a possible option of using proximal half crowns as a retainers. Canine replacement bridges also chose a sort of challenge to the prosthodontist. So in this situation, if you see, now the maxillary canine is subjected to more stresses because the forces are directed outwards and the pontic lies further outside the interabutment axis. Whereas when we are replacing a mandibular canine, this situation is more favorable because the forces are more directed inward and the pontic is closer to the interabutment axis. There is something known as Cantilever Fixed dental prosthesis, which means that you have the support from the abutments at only one side. So this is a fixed, complete or partial denture in which the pontic is cantilevered and retained and supported by one or more abutments. So in these situations, the pontic acts as a lever that tends to be depressed under forces with a strong occlusal vector. So these designs are not very commonly used because of the leverage which is associated with such sort of a prosthesis. So to summarize this part, the selection of the abutment is the key point of success